Hi everybody, I am Dr. Sehtaj Kaur and I secured an All India rank of 1304 in Neet Pg 2023. Currently I am pursuing MD Dermatology. So the Neet Pg 2024 results are out and my heartiest congratulations to all those who have gotten their desired rank and are expecting to get their desired seat. Well, your hard work has paid off, and now it's time to relax, to enjoy, to rest, and to focus on the counseling. I'm sure most of you who have their peers and seniors who are already doing their residency must have told you before that studying for the exam period is one thing and deciding what you want in the counseling, participating in the counseling is absolutely another thing, and that might even be more difficult for you to decide. And actually, it's very true that participating in the counseling is much more difficult than the study period itself. Because in the study period, all you had was just one goal, that you had to study, you had to work hard and secure a good rank. But now you have to choose between many specialities available in the counseling, because that specialty is going to be with you. You're going to practice it for the rest of your life. That is going to be your second wife. So choosing that is also a very tedious task that you have to focus on right now. So in this video I will try to help you out and try to make your decision a bit easier by giving some insights regarding all the specialties that are available. This video is for those who have still not decided what they want right now, those students who are still confused, or maybe those students who had decided what they want but they might not have gotten that their desired rank or maybe too higher rank and they're not getting what they wanted. Those who have decided what they want and they are getting that in their rank, I suggest that do not get confused by other people's opinion. In today's society, everybody is very opinionated. If you're going to follow someone's advice, you're going to make someone else unhappy. So just trust your instinct, trust your decision, and I suggest you go with it. So let us first categorize all the branches into two main groups, that is clinical and non-clinical. In non-clinical, you're going to get pathology, microbiology, pharmacology, community medicine, hospital administration, biochemistry, anatomy, physiology, forensic medicine, etc. etc. These are the names that I remember right now. And the other group is the clinical. Now the clinical also has three groups, MD, MS and DNB. For DNB and non-clinical subjects, I'll make another video. Right now, let's discuss about MD and MS. So the MD group includes medicine, pediatrics, radio, dermatology, psychiatry, anesthesia, radiation oncology, family medicine, sports medicine, palliative medicine, transfusion medicine, and etc. etc. Whereas your MS branches include mainly orthopedics, surgery, general surgery, ENT, ophthalmology, gynecology, and that's about it. We'll also be discussing about the 6-year courses that are offered by DNB, which includes cardiothoracic surgery and neurosurgery. All these courses are also available in the Neet PG counseling. I'll be talking about those courses in another video. Firstly, you have to decide whether you see yourself as a clinician treating patients and being on the front lines, or you want to be behind the curtain and still doing your part in the management of the patient. So that is how you decide between a clinical subject and a non-clinical subject. And obviously the non-clinical subjects are all of them are lifestyle branches, so you're going to get a lot of free time, you're going to have peace of mind even in your residency. So that's something I'll be talking about in another video. Right now let's focus on the clinical branches. Now you have decided to become a clinician, but now you have to decide whether you want to be a physician or you want to be a surgeon, that is MD or MS. Now there are a few people who have always said that they see themselves as a surgeon. From the very beginning of their MBBS, they thought that they are going to be a surgeon. They like to cut, they like to suture. That makes them extremely happy, that makes them satisfied. And if you guys belong to that category, I will advise that you definitely opt for an MS seat. But If you're having even a bit of doubt or you're having second thoughts, there are some things that you should know, you should ponder upon before opting an MS seat. First thing, there is a very long learning curve when it comes to surgical branches. It is not just about theory and bookish knowledge that you can mug up in 3 years, but it's how you apply that knowledge in your operation theater to get the best result in your patient. Yes, you will learn all the procedures in the 3 years of your residency, but it will take a lot many years after that to get your skills polished and to be able to perform even the most minor surgeries also perfectly. Second thing to keep in mind is that surgical branches are more physically challenging. You may have to stand in OT for very long hours, and some people's body may not allow it. It may be tiring for many people. Anyway, surgical branches are more demanding than MD branches. Third thing is, surgery is a dependent branch. Unlike your fellow physician who can just sit in their clinic and earn from the OPD, you cannot do that. You have to do surgeries, and for that you have to either own a hospital or be associated with one. So you need an anesthesiologist, you need staff or assistants, you need an OT setup, ICU setup, ward setup, and a lot of other things too. Fourth thing is that surgeons have to face more lawsuits as compared to a physician. Doctors are humans too, and humans can and will make mistakes. And yes, even the physicians have to face life and death situations while treating the patients, but there are more chances to do harm to a patient while doing a surgery. There have been so many cases of well-known ENT surgeons who have damaged facial nerve while doing mastoid surgery. And although there are a lot of ways to defend yourself in these situations in court, but still, I think it's one of the things that you should think about, and that you should keep that in your mind. There are a few more things that I want to add and talk about. It's that all of you must be open to other branches also according to your rank, and yet your rank should not be the sole reason for you to be selecting a specialty. For example, if someone was very persistent about becoming a pediatrician, but now he's gotten a very good rank and his peers are taking up a radio seat at that rank and he's getting influenced by them. So he gives up the dream of becoming a pediatrician and chooses radiology. So that, I think, is incorrect. That's not right. I do think that branch should be kept before your college, meaning that you can compromise on your college a bit if you're getting your dream branch, but that also up to an extent. A lot of things matter while selecting a college, which includes distance from your hometown, academics, hands-on experience, the toxicity, the brand name of the college, and many other things. All these things have to be judged very precisely, and only then a decision should be made. You have to see what you want from a college and what that college is offering you, and if that matches, then that is going to be on the top of your priority list. Someone might want a gynae, but they also want peace of mind and less toxicity, so they might not choose a college which is very prestigious but is also very famous for its toxicity and long working hours and inhuman working hours. So they might not choose that college and choose another hospital which is not that prestigious, and I think it's absolutely fine, especially after the Calcutta case. I think the safety and the peace of mind and the less toxic environment should be on the top of your priority. That these are the things that you should think about, and not just blindly focus on the prestige of the hospital. The last thing that I want to add is, do not let your parents or your seniors or your peers pressure you into taking up any branch. If you can, you should talk to the residents of the branch that you want. If possible, you should go to the hospital that you're expecting to get admitted in, check it out, check out the department, and then make an informed decision. So that's it, guys. I'll be back with a few more videos for you. Till then, goodbye and take care.